Hello and welcome to our first podcast ever. In this podcast, we're gonna tell you more about phobias. So first of all, what is a phobia? A phobia is an anxiety disorder in which an individual has a sense of exaggerated fear of a certain situation, activity, or object. But first, let us give you some examples of phobias.
There is thousands of phobias among people. However, there are some most common phobias, which are: the first one is the entomophobia, and this is the fear of insects. The second one is the acrophobia, and this is the fear of heights. The third one is the prontophobia. It means the fear of thunder. The fourth one is the claustrophobia, and this is the fear of being trapped in closed areas. The fifth one is the hypochondria, and this is the fear of becoming ill or sick. The sixth one is the zoophobia, and this is the fear of animals. The seventh one is the aquaphobia, and this is the fear of water. The eighth one is the driving phobia, and this obviously means the fear of driving cars. The ninth one, or the last one, is the arachnophobia, and this is the fear of spiders. Luckily, we had the opportunity to interview the Professor Noha Nahas to tell us more about the difference between being afraid of something and having phobia.
Hello, my name is Mahmoud Khalif. I'm currently with Professor Noha Nahas to ask her some questions about phobias.
Hi, my name is Noel Nahas. I am a professional psychologist and adjunct faculty in the psychology department of AUC.
So, Professor Noha, tell us more about phobias.
Okay, so phobias is a psychological disorder, a mental disorder that is under the category of anxiety disorders. Phobias are exaggerated, irrational fear from something. So, for example, it's if you have a phobia from heights, this is irrational, this is exaggerated, then you are diagnosed with phobia. And it's called, in this case, acrophobia, for example. And archophobia, when people are afraid of snakes, agoraphobia, claustrophobia, phobia from water. There are so many types of phobias, but the most important thing that they are exaggerated, irrational fears.
What's the difference between fears and phobias?
This is a very good question, because fears, this is something that two people wouldn't disagree on. Like, for example, I have a fear from darkness, but it's not affecting my life. It's not preventing me from sleeping. But if someone has a phobia from darkness, this person will be developing panic attacks whenever there is darkness. This person's not going to be able to sleep at all in the dark. This person's life going to be affected in a negative manner. So a phobia is a disorder, but a fear, this is just a discomfort that any human being could be facing.
Now, let's hear some examples of phobias that are around us in the university.
I'm afraid of needles.
I have a phobia of the color yellow.
I'm scared of heights, which is called acrophobia.
Here's an interview we had with a colleague of ours that has a fear of belly buttons, which is named omophalophobia.
I basically have a fear of belly buttons, which is basically omphophobia. I'm not quite sure how I got it, but I've always had this fear of coming near my belly button or touching it. I think that's because I grew up knowing that it's very this area is dangerous and I shouldn't come near it, especially with like a cotton bud or anything. I just shouldn't come near it. So that's what I usually did. I never came near it, nor did I want anyone to come near my belly button. There's no specific reason why I feel uncomfortable when someone comes near their own belly button. It's just that I get really irritated and it gets me out of my comfort zone, because I don't like seeing the process of it. Maybe that's because I've always had the fear of, if I come near my belly button, something wrong will happen or I will die.
A phobia of belly buttons. Wow, this is very unique, and this is the first time I've ever heard of it. But to let you know something, that you can have a phobia of anything. We even had that slide on one of our classes that included phobias of number 13, phobias of colors, phobias of the clowns. So people basically nowadays, they can just say that they have a phobia about anything. It's not common, but it's possible. People could have phobias of anything.
Having a phobia from a certain color? Whoa, that's new. Let's see Professor Noha's opinion about it.
How about people who are afraid of specific colors?
This is actually a type of phobia. I can't remember the scientific term for it, but actually there is. There are so many cases that have been reported about people fearing certain colors. So again, the same answer as I said in the first question, which is, yes, some phobias could be rare, but you could have phobia of anything. Did I personally see any of those cases? No. I've seen the common ones. I've seen the acrophobia, the claustrophobia, the agoraphobia. I've seen a lot of fear of needles and injections. And cats is very common, more than you can imagine.
Thank you so much.
You're welcome.
What we can also indicate is that there are certain causes that allows a person to have a phobia. Now, I'll leave you with Farida to tell you more about it.
There doesn't seem to be one particular cause of phobias, but there are 5 factors that might play an important role. First of all, particular incidents or traumas. For example, someone who experiences a lot of turbulence on a plane at a young age might later develop a phobia about flying. Another factor is learned responses, picked up in early life. Factors in the family environment, such as parents who are very worried or anxious, can have an effect on the way you cope with an anxiety in later life. You might also develop the same specific phobia as a parent or older sibling. Also, genetics can play an important role. Some research suggests that some people are more vulnerable to developing a phobia than others. Also, responses to panic or fear. If you have a strong reaction or a panic attack in response to a particular situation or object, and you find this embarrassing or people around you act strongly, it can cause you to develop more intense anxiety about being in that same situation again. Last but not least, long-term stress can cause feelings of anxiety and depression. So it reduces your ability to cope in particular situations. This can make you feel more afraid or anxious about being in those situations again, and over a long period could lead to you developing a phobia. But there is an important question we're missing here. How can I know that I have a phobia? Are there specific symptoms?
Yes, Farida. There are a number of symptoms, but let me tell you how the phobias develop inside your brain. Some phobias develop when someone has a scary experience with a particular situation. A tiny brain structure called the amygdala keeps track of experiences that trigger strong emotions. Once a certain situation triggers a strong fear reaction, the amygdala warns the person by triggering a fear reaction every time he or she encounters that situation. Someone might develop a bee phobia after being stung or during a particularly scary situation. For that person, looking at a photograph of a bee, seeing a bee from a distance, or even walking by near flowers where there could be a bee can all trigger the phobia. This then leads us to the symptoms such as trembling, sweating, shortness of breath, also a choking sensation, rapid heartbeat, pain in the chest, a sensation of butterflies in the stomach. In addition, it can cause dry mouth, a need to go to the toilet, ringing in your ears, also confusion. However, guys, you have to know that there are different types of phobias. Is that right, Muhammad?
Yes, that's right. There are 3 different types of phobias. First one is specific phobias. These are the most common types of phobias. As the name suggests, they refer to persistent, unreasonable fears of specific objects, situations, or places. Exposure to the feared stimuli results in an immediate anxiety response, which may include such trembling, sweating, and increased heartbeat, as Ayman mentioned. Even the mere anticipation of an encounter with the feared stimuli may be enough to trigger anxiety. Common examples of specific phobias include fear of closed spaces, which is called claustrophobia, fear of heights, acrophobia. Other examples include fear of blood, air travel, snakes, thunderstorms, and elevators. Another type of phobia is social phobias, also called as social anxiety or social anxiety disorder. A social phobia is a strong, persistent fear of a social situation in which humiliation or embarrassment may occur. In feared social situations, individuals with social phobia may worry that others will criticize or judge them, or that the way they speak or do anything that might embarrass themselves and make a poor impression in front of people. In these situations, they almost always experience symptoms of anxiety such as tremors, diarrhea, blushing, and sweating. Therefore, they try to avoid these settings in the beginning. I also found out that people with social phobias may fear situations such as speaking, performing, eating, drinking, or writing in the presence of others. They tend to be hypersensitive to negative evaluation and may experience feelings of inferiority. The last type of phobias is complex phobias. And complex phobias tend to have the most disruptive and disabling impact on your life than specific phobias. They tend to develop when you are an adult. Two of the most common complex phobias are social phobia and agoraphobia, which is the fear of places and situations that can make a person feel trapped or helpless. I heard one time that someone had a phobia from the number 4. Is that true?
Yes, Muhammad, that's true. Phobias might also develop due to cultural belief. For instance, tetraphobia or the fear of number 4 is widely spread in China due to the fact it resembles death. East Asian nations fear the number to the point that they have removed it from everything, including elevators, room numbers, serial numbers in cars, and even more.
Talking about unusual phobias, there is a famous study done by Dr. Lisette Saavedra and Dr. Wendy Silverman. It was about a 9-year-old Hispanic American boy. He presented with his mother to the Child and Anxiety and Phobia program at Florida International University with an avoidance of buttons. The boy met DSM-IV criteria for specific phobia of buttons, which is the diagnostic and statistical manual for mental disorders. The problem began when the boy was 5 years old in kindergarten, during an art project that involved buttons. He described the situation in which he ran out of buttons to paste on his poster board and was asked to come to the front of the class to retrieve more buttons from a large bowl on his teacher's desk. When he reached for the bowl, his hand slipped and all the buttons in the bowl fell on him. He described this experience as distressful, and since then both the boy and his mother reported that his avoidance of buttons continually increased. At first, his avoidance of buttons did not present many difficulties, but as time progressed, it became more difficult for him to handle buttons. This led to several areas of interference for the boy and his family, such as not being able to dress himself and difficulties concentrating in school due to excessive preoccupation with not touching his school uniform or anything that his buttoned shirt touched. Outside school, he avoided wearing clothing containing buttons and avoided contact with buttons that others wore. This was observed as having a specific phobia. However, Dr. Saavedra and Silverman managed to help this young boy by using different treatments.
Behavioral exposures. A child was treated with an exposure-based treatment involving cognitive and behavioral procedures. The treatment involved first using contingency management, in which the mother provided positive reinforcement contingent on the child's successful completion of gradual exposure to the buttons. Treatment sessions lasted about 30 minutes with the boy and 20 minutes with the boy and the mother. The most difficult buttons were small, clear plastic buttons usually found in button-sewn shirts. Handling these or coming into contact with anyone wearing them was the most difficult task. By session 4, the boy successfully completed all exposure tasks. Despite the success observed in the boy's approach behaviors, subjective ratings of distress increased dramatically from session 2 to session 3 and continued to rise from session 3 to session 4. He reported feeling more distressed about wearing or handling buttons. His ratings of distress were increasing, not decreasing. This finding was unusual, given that in the treatment of specific phobias with cognitive behavioral treatment, it is generally observed that with repeated exposure to the feared stimulus, ratings of distress decrease over time. Further probing revealed that the boy found buttons disgusting upon contact with his body. He also expressed that buttons emitted unpleasant odors. The next 7 sessions consisted of incorporating disgust-related imagery, exposures, and cognitions. This case study highlights that doctors should remember disgust and evaluative learning when treating certain types of childhood phobias. Future research should examine the specific types of phobias in which disgust plays a predominant role. Also, it will be important to conduct controlled group studies manipulating disgust in treatment and examine the efficiency of such manipulation.
I personally thought I'm suffering from a lot of phobias, but I guess it turned out that I'm just scared of stuff now that I understand. So this means you might find it helpful to try to work out your specific cause for your own phobia, but you might equally feel that there is no simple explanation. If you avoid the object or situation that is making you phobic, that will often make you fear worse over time. However, it can be extremely difficult to face your phobias, and you may need professional help to enable you to do this. And one last thing,